Hey everyone, how's it going? If you're new to my channel, my name is Ajay and I'm a current first-year resident in Chicago. It is no secret that physicians make a comfortable living, and I even touched on this fact in my previous video in which I talked about the top 5 highest paid specialties in medicine. If you haven't seen that video, please feel free to check it out. I actually revealed that the #1 highest paid physician, a plastic surgeon, averages around $501,000 US a year. But not every doctor is a plastic surgeon or even in the top 5 highest paid specialties. Therefore, in this video, I'm going to be talking about the top 5 least paid specialties in medicine. At number 5, we have infectious disease with an average salary of $231,000 a year. While I know that this can sound like a lot of money, it is not that much compared to other internal medicine subspecialties such as cardiology or gastroenterology. Infectious disease specialists first complete a 3-year internal medicine residency and then a 2-year infectious disease fellowship. Infectious disease doctors typically work in hospitals, and when patients come in with difficult to treat infections such as UTIs or really bad pneumonias or just have a lot of allergies and it's tough to treat them with a certain antibiotic, then they get consulted and come in to treat the patient. I believe Dr. House on the television show House was actually an infectious disease doctor. However, the show didn't really depict the actual role of an ID doctor. So if you're not doing procedures as a physician, you're mainly managing diseases in the outpatient setting or the inpatient setting and prescribing antibiotics and working as a consultant, then you won't make as much money. You're unable to build Medicaid and Medicare for your services, and then your salary is going to be less. At number 4, we have internal medicine with a salary of $230,000. Internal medicine doctors work as hospitalists in the hospital and typically have very bad lifestyles. They often work multiple 12-hour shifts, and they are one of the most burned out physicians. However, they have an amazing general knowledge for treating typical hospital patients. They know how to treat patients with a heart attack. They know how to treat patients with liver failure. They know how to treat patients with kidney failure. They know how to treat patients with pneumonia, etc. They are a sort of jack of all trades. But like infectious disease doctors, they do very little, if any, procedures. So their job is typically just to manage patients, prescribe medications, and get them better and then send them out of the hospital. The fact that you can make over $400,000 as a gastroenterologist or cardiologist if you do an extra 3 years after the 3 years of internal medicine residency compared to the $230,000 if you just do the 3-year internal medicine residency is why a lot of people are tending to specialize. They realize that you can make double the salary if you do these fellowships. As a hospitalist, you have to work multiple 12-hour shifts, you have to work nights, you have to work weekends, and it just gets really tough. You also have to respond to emergencies in the hospital. So for an example, if a patient is about to die, they run into the room and perform CPR. If a patient's blood pressure drops, they run into the room and try to give them fluids and medications and try to resuscitate them. And again, $230,000 is a lot of money. It's not like they're poor and they're struggling to find food and they're begging on the streets. It's just that they're not making as much as other doctors. But that's okay. Not everyone has to make the same amount of money. Not everyone has to do the same thing. At number 3, we have family medicine with an average salary of $219,000 a year. Family medicine doctors typically work 9 to 5, Monday through Friday, managing diseases in the outpatient setting. They see a broad range of conditions from head to toe. One good thing about family medicine is that their patients aren't severely sick, and unlike hospitalists or internal medicine doctors, they get to build long-term relations with patients. One family medicine doctor that I shadowed actually saw a patient for over 30 years. They were his patient for 30 years, and it was great to see them and take care of them through their lifetime. In fact, he ended up taking care of that patient's daughter later on, and even her daughter's daughter. And it's just amazing to take care of an entire family. Maybe that's why they get the name family medicine. However, the only downside to this route is that family medicine physicians can't really subspecialize like internal medicine doctors do. The only subspecialty that I know of that family medicine doctors can do is sports medicine. Furthermore, burnout rate is high. It is difficult to pay back your loans when you're only making $200-something thousand a year. You have taxes and you have malpractice insurance. It all adds up. But if you like being that doctor that takes care of everything from head to toe, knows when to refer to specialists when you have to, and likes building long-term relationships with patients, then definitely consider family medicine. At number 2, we have a tie between diabetes and endocrinology and pediatrics with an average salary of $212,000 a year. Diabetes and endocrinology is actually a fellowship of internal medicine, so you have to do 3 years of internal medicine followed by a 2-year fellowship in diabetes and endocrinology. I personally think that it's crazy that these doctors do a 2-year fellowship after internal medicine and actually make less than hospitalists. However, I do understand why. The lifestyle of diabetes and endocrinology is much better than an internal medicine doctor, and they work much less hours. Diabetes and endocrinologists typically work in the outpatient setting Monday through Friday, 9 to 5. They deal with a lot of patients with really bad diabetes, type 1, type 2. They manage insulin doses, and they also treat patients with a lot of thyroid issues, like patients who are hyperthyroid or hypothyroid. Occasionally, these doctors do get consulted into the hospital with patients with a lot of metabolic issues or really uncontrolled diabetes. So they do also go to the hospital, but only occasionally and on consult when they are called in. So the choice is up to you. If you want to make around $20,000 less than an internal medicine doctor, but have a better lifestyle, definitely go for it. However, if lifestyle isn't that big of a deal to you and you don't want to do an extra 2 years of fellowship and you're happy being a hospitalist, do that. In addition, diabetes and endocrinologists do not perform many procedures, which is another reason why their income is not as high as other doctors. So it's no secret that pediatric physicians make less than their internal medicine counterparts. Pediatric doctors treat newborns, adolescents, children, teenagers, all the way up to the year of 18. They work in the hospital setting just like internal medicine doctors do, but again, they treat kids. Furthermore, they can also work in the outpatient setting and treat kids specifically in the outpatient setting. So how are adults and kids different? Well, for one thing, certain children under a certain age can't really swallow pills. So a lot of their medication comes in liquid form, and it's really difficult to figure out the dose because that liquid form is based on their weight plus some other factors. Unlike adults who typically just get pills, they just swallow it and it's more straightforward. In addition, anyone who is under the age of 18 is considered a minor, and unless they are emancipated, they cannot make their own medical decisions. Therefore, pediatricians have to deal with the parents, typically the mom and the father, and then they also have to deal with the child. So they deal with 3 people in order to get the medical care. Additionally, it's tough to treat a newborn and have one set of thinking for how you treat a newborn compared to a child, compared to a teenager who typically functions as an adult. However, many people don't like treating adults and the problems that come with them, and they prefer to treat sweet, innocent little kids. So if this is you, definitely consider pediatrics. Dun dun dun! At number 1, we have public health and preventative medicine with a salary of $199,000. So there you go. Even the least paid medical specialty still makes at least $199,000, which is a lot of money compared to the average person. However, please don't forget that medical school is extremely expensive. It's about like $60,000 a year in the United States. Therefore, because of the long track to become a doctor and the long track of medical school and the costs associated with medical school, physicians like to be compensated so they can pay back these issues. So, what are these doctors? So these doctors actually have the shortest residency length of only 2 years. So if you just graduated medical school and you want to do the shortest residency possible and get practicing right away, definitely consider this field. So let's say there's a lot of chlamydia or gonorrhea going on in the area that they're working in. Maybe they'll work with government organizations on advocating for better condom use or better birth control or just more education for the general population. If there's an outbreak of something like tuberculosis, maybe they'll work on better reporting or work with hospitals on how they can manage these conditions and give better antibiotics or make antibiotics more readily available, etc. So it's a really public health type position where you just try to better the overall healthcare of your community. All right, there you guys have it. That's the top 5 least paid specialties in medicine. So tell me, do you guys agree with this list, or is there something that was on here that shouldn't be there? Let me know in the comments below. I'm always excited to discuss this stuff. That's why I make these videos. I'm a huge nerd. I love talking about this stuff. I love talking about salaries. As you guys know, I'm no bullshit. I'll tell you how it is. I try to find the most up-to-date facts available. I try to research the topics the best I can and present my opinion in these videos. If you like this video, please give me a thumbs up. If you loved it, please consider subscribing. Until next time, take care.